critical and hard-working pieces of machinery in existence, the human heart. I mean, it literally beats about 100,000 times a day, perfectly calibrated to meet your body's every need. But what happens when the most important pump in your body can no longer keep up with demand? Well, it sets off a fascinating, albeit super dangerous, domino effect throughout your entire body. Let's get right into it. So here's a quick look at our roadmap for today. We're going to trace the literal journey of blood. We'll start by defining what heart failure actually is, break down the two main ways the pump malfunctions, and then follow the cascade of failure, first to the left side in the lungs, then to the right side in the rest of the body. Finally, we'll wrap up with how modern medicine tries to fix this plumbing disaster.
All right, section 1. What is heart failure? Let's define exactly what we mean physically when the pump just can't meet the demand. Okay, so simply put, congestive heart failure, or CHF, is the point where your heart's ventricles just cannot supply enough blood to keep up with your body's demands. And that word congestive, it's very literal here. Since the pump isn't pushing blood forward like it should, that blood has to go somewhere, right? So it backs up. It causes severe congestion, literally fluid buildup in your lungs and throughout the rest of your body. To really get a grip on this, we've got to look at the math of a heartbeat. Your heart has to squeeze out a very specific volume of blood every single minute to keep you alive. We call this your cardiac output. You calculate it by multiplying your heart rate, the number of beats per minute, by your stroke volume. Now, stroke volume is just the amount of blood ejected with each beat. But here's the catch, and this is super important. Not all the blood in the ventricle gets pumped out every time. The stroke volume is really just a fraction of the total blood hanging out in that chamber. To brilliantly illustrate what this looks like in a failing heart, imagine a left ventricle holding a total volume of 110 milliliters of blood. In this scenario, only a 44 milliliter fraction actually makes it out when the heart squeezes. That means a whole 66 milliliters is just lingering left behind in the ventricle, waiting for the next beat.
Which brings us to a pretty stark number: 40%. In a healthy adult, a normal ejection fraction, which is the percentage of blood successfully pumped out, is usually around 50 to 70%. But if you do the math on those numbers we just looked at, 44 milliliters pumped out of a total 110, you get exactly 40%. And medically speaking, anything at or below 40% is a mathematical indicator of systolic heart failure. The heart is literally just too weak to push out enough blood.
Moving on to section 2, pumping versus filling dysfunction. We're going to look at the two primary ways the mechanics of this pump actually break down.
Now, there's a really crucial juxtaposition here. On one side, you've got systolic heart failure. This is a squeezing dysfunction. The pump is too weak, which gives us that low ejection fraction we were just talking about. But on the flip side, there's diastolic heart failure, and this is a filling dysfunction. The heart muscle itself might actually squeeze perfectly fine, but it's gotten so stiff that it can't fill up with enough blood in the first place. So even if the ejection fraction looks totally normal, say 64%, the total volume of blood actually moving through the system is dangerously low, simply because the chamber never fully loaded up.
Now, a healthy heart actually has this amazing built-in biological workaround for low blood flow. It's called the Frank-Starling mechanism. Think of it exactly like stretching a rubber band. When you load the ventricle with blood during the filling phase, it stretches out the cardiac muscle. And the more it stretches, the harder it snaps back or contracts when it's time to pump. But in a failing heart, this mechanism gets pushed way past its limits. It constantly stretches those heart walls until they eventually become dangerously thin and weak.
Section 3. Left-sided failure, the lungs. Heart failure usually doesn't hit the whole heart all at once, and the left side is almost always the first domino to fall.
Let's walk through how this cascade builds. We'll use chronic high blood pressure or hypertension as our example, since it's incredibly common. First, arterial pressure shoots up in the body. It's kind of like trying to push water through a severely kinked hose. To compensate for that resistance, the left ventricle has to bulk up, the muscle hypertrophy so it can push harder. But here's the problem. More muscle mass demands more oxygen, and ironically, this bulky muscle ends up squishing its own coronary blood supply, so oxygen demand completely outpaces supply. The muscle weakens, and boom, systolic failure occurs. The pump breaks.
And right here is where we hit a tragic, almost ironic twist of human physiology. When the heart pumps less blood makes it to your kidneys. Your kidneys absolutely panic. They think, oh no, we must be dehydrated. So they activate this complex chain called the renin-angiotensin-aldosterone system. Basically, it tells your body to retain fluid to boost blood volume. But remember, the pump is already failing. Holding on to more fluid is literally the worst thing you could do. It just dumps more liquid into an already broken plumbing system and dramatically worsens the backup.
So where does all that backed up fluid from the left side actually go? Well, it goes straight backwards, right into the lungs, and this causes some truly terrifying symptoms. Patients will experience dyspnea, which is severe trouble breathing. They also deal with orthopnea, meaning they struggle to breathe just lying down flat, because gravity lets venous blood from the lower body rush back up and flood the pulmonary circulation. Doctors can actually hear crackles in the patient's lungs. At a microscopic level, the pressure gets so high that lung capillaries can actually rupture. Immune cells called macrophages come in to clean up the spilled red blood cells, taking on a brownish iron color. We literally call them heart failure cells. Which brings us to section 4, right-sided failure, the body. The cascade continues, and once the lungs are congested, the next domino is ready to fall. Because the two sides of the heart work in series, left-sided failure usually triggers right-sided failure. The right ventricle simply cannot pump against the massive wall of fluid pressure building up in the lungs. But occasionally, the right side fails all on its own. We call this cor pulmonale. This happens when chronic lung diseases cause long-term low oxygen, or hypoxia. The blood vessels in the lungs constrict in response to that, which raises pressure specifically on the right side of the heart. Eventually, that forces the right ventricle to bulk up and fail completely independently of the left side.
Now, if the left side failing backs fluid up into your lungs, the right side failing backs fluid up into the rest of your body. Basically, gravity takes over. The fluid pools up into the jugular vein in your neck, making it distended and supervisible. It pools in the liver and the spleen, causing painful enlargement. This excess fluid can even leak into the empty space in your abdomen, a condition known as ascites. And visibly, you'll see it pool in the soft tissues of the legs. This causes pitting edema, where the leg gets so swollen that if you press a finger into it, it leaves a physical pit that takes a while to bounce back.
All right, let's head into our final section, managing and treating CHF. How do we actually go about fixing this massive plumbing disaster?
So, the absolutely crucial point here is that while we usually can't reverse the underlying damage to the heart muscle, we can aggressively manage the backup. We use medications like ACE inhibitors to dilate the blood vessels, taking some of the pressure off the pump. We give diuretics to force the kidneys to flush out all that extra fluid. If the damaged heart cells are misfiring and causing out-of-sync arrhythmias, we can implant pacemakers to get the beat resynchronized. For seriously failing pumps, we can actually implant ventricular assist devices, or VADs, to mechanically push the blood for the heart. And of course, in severe end-stage situations, the only option left is a total heart transplant.
The human heart is incredibly resilient. It'll compensate and adapt right up until the point it literally just can't anymore. But when you look at the amazing advancements we're making in things like ventricular assist devices, I want to leave you with this thought. As this technology continues to miniaturize and get better, will we eventually engineer a mechanical pump that's so perfect and so reliable that biological heart failure becomes completely a thing of the past? It's a pretty mind-blowing frontier in medicine. Thank you so much for joining me on this explainer today. Keep wondering, keep learning, and I'll catch you on the next one.